So let me give a little bit of a demonstration, and then we can then proceed with further discussion. So let me now share my screen again. Okay, can you see my screen?
Yes.
Okay, so what you'll see in what I demonstrate to you is our training, our online training makes extensive use of cases that either demonstrate how to perform community health work or where the trainee actually gets to practice community health work competencies themselves. This is part of a blended learning solution. So what we do in our course is we give students an opportunity to practice on their own online to develop the core competencies. And then we bring them together in online collaborative exercises through video conference, whether they can further practice the skills that they have developed. So let me sort of go through this quickly. So let me start by with an example conversation. In this case, Sarah, our community health worker, is contacting Ms. Rodriguez to inform her that she needs to be to isolate because she's been contacted with someone with COVID-19. So let's see. Oh, I'm sorry, I am still in the what is going on here? This must be the, okay, this is still the deck. That's the problem. Let me get out of the deck and into the course itself. Okay, so we have a few different courses here. I'm going to go into the Community Health Worker Reskilling course. So I run this in my web browser. Trainees can access this either on their laptop or mobile device. And what I'm going to do is go to one of our initial modules, which is really just about introducing yourself to a patient and developing rapport. So let's get started with that.
Hello?
Good afternoon. My name is Sarah Hernandez, and I'm calling from the Department of Public Health. Is this Ms. Rodriguez? Initially, address the patient by their title and last name. If you're unsure, it's a good idea to ask how the patient wants to be addressed.
I'm Miss Rodriguez. Why are you calling me?
I need to speak with you about COVID-19 and your health. Is now a good time to talk privately?
Sure.
So a trainee gets to watch how the interview takes place. Then they learn a little bit of the background where we highlight the core competencies that are being employed here.
In this lesson, you'll learn to introduce yourself and establish credibility. Verify you have reached the correct person. Build rapport. Address confidentiality. The beginning of a contact tracing conversation is simply, it is important.
Let me skip through this. So now from the very early on, you get to practice the competencies that you are learning. And we find this to be very important because particularly with trainees who may have limited literacy, you know, they may scan through material and not really internalize it very well or know how to apply it. Whereas here you get to start applying it right away. So the trainees know right away, are they on track with what is being covered here, or do they need to go back and study some more? So let's see, introduce myself.
Hello?
Hello, I'm Lewis Johnson with the Department of Public Health.
Oh, okay. Hi?
So we use what's called natural language understanding technology so that the software can actually evaluate the trainee's response and make sure that it is appropriate in context. It doesn't require following a script. In fact, the whole benefit of this training is to help people get away from the idea of following a script to actually being able to interact in a natural, appropriate way with patients. So then we proceed further with the lesson. Okay, here another example. Am I speaking with Ms. Rosalie Rodriguez? Again, so get immediate feedback. So I proceed with these types of exercises, and then I get to actually apply them in the beginning of an actual patient interview. Now, this, what you're seeing here, is one of the introductory modules. So this is just basic introduction, developing rapport. Modules further on get into critical issues in terms of how to communicate health information, overcome resistance, help with barriers to getting care, all the different things that community health workers may need to do when they're working with patients. Call Rosalie Rodriguez.
Hello.
Hello, this is Louis Johnson from the Los Angeles Department of Public Health.
Hi.
I'd like to speak with Ms. Rosalie Rodriguez.
This is Miss Rodriguez.
Hi, Ms. Rodriguez. I'm glad to have a chance to speak with you today. I'd like to talk with you about some issues relating to COVID-19 and your health.
Sorry, can you say that a different way?
Hi, I'd like to speak with you about some issues relating to COVID-19 and your health.
Sorry, can you say that a different way?
I'm happy I've reached with you today. I'm calling today to discuss some health concerns related to COVID-19.
Oh, goodness. What is it?
I'm afraid you've been in contact with someone who has tested positive for COVID-19.
Oh, my. Is it Luis? I told him he shouldn't be going to those parties.
I'm afraid I can't discuss that. You see, we keep all health information private.
Okay, I understand.
And everything we talk about today will be private as well, of course.
Okay, this sounds serious.
So first of all, Ms. Rodriguez, how have you been feeling lately?
I'm feeling fine. I haven't been sick at all.
So now we get a review of how well I did, and I met all the objectives. And you saw it didn't work, understand me 100% of the time, but we continue to work using the data that we collect from people interacting with the platform to further retrain and improve the AI so it gets better and better over time. So let's see how well I did here. So I was able to meet all of the key objectives in this part of the conversation. So now I have an opportunity to go and practice some more, and we encourage trainees to practice as much as they need in order to fully master these skills. So with that little bit of background, let me show you a little bit of some of the data that we collect from trainees using the platform. So now I'll go into the instructor view, and I will look at archived classes. And so now I can look at one of our cohorts of community health worker trainees. I can see for each one of them how much time they have spent practicing. By the way, this total time here is the amount of time that they spent in simulated patient interviews. So for example, these students, they've been through over 3 hours of role playing these community health worker training scenarios. And now I can look in more detail at how this student performed. And you can see that the student met all of the objectives, 100% maximum score each time. We can also see that they practiced multiple times to improve their skills. So for example, in this module on collecting demographic information, we can see that they started out, didn't do so well the first few times, but toward the end, they were able to meet all of the objectives. So practice makes perfect in this case. So, so it gives you an initial overview. So we couple this, as I say, with online webinars, as well as collaborative role play exercises, which are supervised by instructors to make sure that the trainees get the necessary, that they are, to confirm that they're mastering the necessary skills. We also employ patient navigators. In fact, let me share a screen again, just to show you a little bit of the classroom view of this. So basically what we do is we call program navigators who are trained as community health workers who work online with the students to make sure that they work successfully through the program, that they stay on track, and that ultimately they're prepared to be placed in jobs. And so we find this combination of online practice and support by program navigators to be a very powerful and effective approach for helping ensure that trainees get through the program successfully and are well prepared to be placed in jobs. So let me pause there and see if we have any questions that we could answer at this point.